to discuss a very important topic, how to fight against Noma. We have the pleasure to have with us today the Minister of Health of Nigeria, and for sure victims of the Noma, as well as MSF, who is organizing this conference. So I won't go much further. I just want to welcome also all those, and there are many right now, who follow us on Zoom, and also all the people following us on live streaming. We have a live stream on www.pressclub.ch. This is our website. And we have also this live stream on YouTube as well as Facebook Live, so many different ways to follow this conference. Thank you very much, and I give the word to Mark Sherlock from MSF. Thank you. Close to the mic, sure.
Bonjour, and hello, and thank you for joining us here today. My name is Dr. Mark Sherlock, and I'm a health advisor with MSF, and have the privilege of being your host this morning. I want to warmly thank you for joining us for this in-person and online hybrid event. After nearly 2 years, or over 2 years, of working online, I'm delighted to see so many people here today amongst us face-to-face in Geneva, in this wonderful building, in this perfect location in Geneva, and also to the many, many people joining around the world online. A few housekeeping rules just to get us started. If you can please put your telephones on vibration or on mute, or turn it off. And for anybody requiring translation, we've got translation services here in the venue. And online, also, we've got the option of having translation, so just select the French or English. The spoken language will be English, but please select French online if you so require it. I want to start by thanking our special guests who are joining us here this morning. It is a privilege and an honor to have the Honorable Minister of Health of Nigeria, Dr. Osagi Iheneri, here this morning to share his thoughts on the eradication of Noma and the steps he is championing to make this happen. It's also a pleasure to have Dr. Bente Mikkelsen, Director of the Non-Communicable Disease Division of the WHO, here, who will speak later this morning. Today's event is titled Noma, a disease that should not exist anymore. Through a wide array of partners, including government, medical professionals, and advocates, we will be sharing the spotlight today on the highly neglected disease, Noma. I want to briefly outline the agenda for which we will follow this morning, and it is 3 parts. Part 1 is a call for action at the international and grassroots level with a focus on lived experience. Part 2, we'll have a panel discussion with Noma experts, and this will be followed by part 3 and closing remarks by Dr. Bente Mikkelsen. And for those unacquainted with the medical acronyms, and I do apologize, there may be many that come up in this event, but I just wanted to outline 2 major ones that you might hear. That is NTD, so neglected tropical disease, and maybe MOH, the Ministry of Health. And before we begin, we can already celebrate as a community this one major achievement. All of us here today using a collective voice to highlight Noma as a priority public health issue. World Health Assembly 74 was a milestone for Noma, where the historic Oral Health Resolution called for Noma to be included into the 2021 to 2030 NTD roadmap. However, it's not uncommon to hear of the highly experienced public health professionals who will say, very sadly, that they've never heard of Noma. And I include myself in this. I did not hear of Noma until I treated my first patient in 2017 during field work as a doctor with MSF. And despite the ongoing tragedy that Noma continues to be, we launched this event with much hope and with cohesion of many voices, loud and clear. That advocacy for Noma and affected communities is now sharply on the rise, and so once again, we thank you for being here and for adding your voice to this. I'd like now to proceed to part 1 of this event, And it's a great pleasure to introduce the Honourable Minister of Nigeria, Dr. Osagi Inhairi. The Honourable Minister is a surgeon by training and has served at various times as a prominent member of the boards of Edo State Health Management Board and T.Y. Danjuma Foundation, among others. Prior to his appointment as the Honourable Minister of Health, Dr. Osagi served as the Honourable Minister of State for Health from November 2015 to May 2019. Dr. Osagi has been championing Noma at both the local, national level and international level, and it's a great pleasure to share this podium with him this morning. Welcome, Dr. Osagi.
Good morning, everybody. It is my pleasure to be here with you at this event, and I want to thank all those who have attended. Noma, as has just been described, is one of the neglected diseases, neglected in the sense that it is there, but you don't see it. And you can compare it with one other problem we have in the developing world, and that is the obstetric fistula, which also is one of the neglected problems. And in Nigeria, it's getting relatively good attention with the creation of specific obstetric fistula hospitals. That has not been so for Noma yet. For those who would like to know more about Noma, I think the best thing is to just Google it up, N-O-M-A, and that's what I would recommend, because it's difficult to say everything about it. But it's a disease that begins in early childhood, let's say between 2 and 6 years of age, and is associated with poverty, malnutrition, poor nutrition, nutritional status, unbalanced diet, perhaps lack of vitamins, and missed opportunities for immunization, and then any opportunistic infection around the gum, where it usually will begin and spread rapidly, eating away not only the soft tissue, but in fact the hard palate, and creating very bizarre appearance that you can perceive as frightening if you were to see it. Now, there is stigma that goes along with it, and those who suffer from this actually go into hiding, and you don't see them because they do not fail to attract attention. So it is time, as we begin to take a comprehensive look at the health sector, to look at those areas that will have remained hidden, if not that someone shines a light on it. And it's for that reason that I would like to commend MSF for the work they are doing in Sokoto, in Nigeria, supporting the Noma hospital over there, and bringing not only treatment to those who are suffering, but also some happiness to the families of those who hide people in their family suffering from Noma, because not only the stigma about the person, but also about his family, in the sense that if you have somebody with that kind of disease in your family, well, nobody wants to have much to do with you. So families are gratified that you have that kind of support, and also begin to know that if you are taking care of health as a whole, you don't want to leave anyone behind, not even the Noma sufferers. So it is my privilege to have written to several countries to co-sponsor the inclusion of Noma in the list of neglected tropical diseases. Yes, it is in the tropics. It is neglected. But it's not that it's a tropical disease in itself. There is a family from Germany that also became quite interested in this problem and decided to support the treatment of Noma after seeing it on television. So they sponsored a lot of treatments, and decided to, in fact, set up a hospital, or rather, let us say, a clinic within a hospital where you can give attention to Noma patients and do the kind of work that MSF is doing in Sokoto. So we'll now have two Noma hospitals. And these hospitals will also be reference centers to bring in from various parts of the country once it is known that you can get help there at no cost, because the sufferers are invariably people of very little means and will not have a way of paying for the treatment anyway. So the fact that it's free at no cost is very important for a poor family. So it will be a reference center where, in fact, you might even have to sponsor the treatment, the transport of Noma sufferers, because they probably couldn't even afford the transport, to come into the hospital and receive specialized treatment. The specialties required will be dental, maxillofacial, plastic surgery to reconstruct and rebuild the face. And as you are doing that, you are rebuilding the confidence. There is nothing that tells more about you than your face. And if your face is damaged the way it is by such an infection, you can imagine what it is. The kind of psychological and mental torment it must be for those who are victims of Noma. So the fatality rate is very high, and those who in fact survive past the years of survive the infection for a few years are lucky. So the treatment generally will be basic, proper nutrition, immunization, and then wound dressings, antibiotics, and eventually surgery, reconstructive surgery. And much of it will have to do with mobilization of flaps to fill the defects that have arisen over there. Some of it can be quite extensive depending on how much damage has been done. Remember, you have both soft tissue and hard tissue damage, which can take quite a bit of expense and time to reconstruct. So we hope that we're able to bring global attention to this disease and also have a pathway to work towards elimination of Noma. It is possible, and it is that is the target. And without the support of those who also have that feeling that, yes, this is something we should do, this is something that we should not have anymore in this century, I'm sure that we can mobilize not only the resources, but also the energy to drive the project and get the Noma off the face of the earth. There are many people who will be grateful and thankful for that. Thank you for your attention.
Thank you, Honourable Minister, for your words, your wisdom, leadership, and champion Noma globally, and for the, as you said, the eradication of the disease. As you know, it is World Health Assembly Week here in Geneva. The Minister will need to leave shortly for a statement at the UN Palace. So I'd just like to offer up another round of applause before he leaves, just for his support and continued leadership. I would next like to introduce a colleague of mine, Dr. Maria Guevara. Dr. Maria Guevara is the current International Medical Secretary for Médecins Sans Frontières. Previous to this, she was a senior advisor on global health from 2018 to 2020, and senior coordinator for attacks on healthcare from 2017 to 2018, and then previously held positions of humanitarian representative in Asia. It is an honor to invite my colleague to the stage for some words from MSF.
Thank you very much. If you don't mind, I will stay seated. Thank you for this opportunity today to be here with you all. It is really an honor to share the stage with the Honorable Minister of Health of Nigeria, Dr. Osagi Ehanire, and Mulikat Okanlawo, Noma survivor, advocate and messenger of hope. I am a human being like others, These are the beautiful words of Mulikat, an affirmation of self, newfound courage, and message of hope. I'm using it as an opener because it signifies clearly the sentiments that speaks to us all, that feeling and need to belong and be considered to be human like others. For many of us here today, we are lucky. Noma did exist in Europe and even in the US, but has since disappeared with improvements in hygiene and nutrition in the 20th century, with the exception of reported cases in concentration camps during World War II. Today, Noma incidence and prevalence are actually not fully known globally, but data does exist in West Africa because of the focused work of the ministers of health in the region and a few medical organizations as MSF. What we do know about Noma is that it is absolutely preventable, but only if there is knowledge about the disease and how to treat it. Good nutrition, oral hygiene, and access to healthcare and vaccinations against childhood diseases all help to prevent Noma. And it is most definitely treatable if detected and managed during the first weeks of the disease with basic oral hygiene, antibiotics, and wound dressing. A patient can recover from Noma within a few weeks. This is helped by managing underlying risk factors such as malnutrition and other diseases like measles. In MSF, we view the management of Noma through a holistic lens with a patient-led and person-centered care approach, viewing the patient as a person, a human being, part of a family and of the community, with agency of choice. Since 2014, MSF started supporting the Sokoto Noma Hospital, providing medical care for patients coming from all over Nigeria through the following activities. Outreach, with a focus on detection and treatment for people in the first stages of the disease, nutritional support, mental health support, acute Noma surgical management, and reconstructive surgery. The hospital was founded in 1999. It is the first, and now we know the second, hospital in the country, and one of the few in the world that serves as a haven for adults and children who have survived this painful disease and now need further treatment and reconstructive surgery. It is a place where, for many affected by the disease, find hope and the possibility of realizing their dream of a new face, who come in barely able to breathe, eat, speak, or open their mouths, to walking out with a new lease on life and a smile on their new reconstructed face, feeling like a human being, like others again. But as said, it is one of the few hospitals in the world providing such services, and only for those who had survived. Up to 90% of people affected by Noma die in the first 2 weeks if they don't receive the treatment with antibiotics in time. That is why early detection and awareness-raising campaigns are so important for a disease that affects an estimated 140,000 children every year. And these numbers are actually estimates that the World Health Organization made in 1994 and has not been updated in more than 25 years, showing just how neglected the disease and its survivors are. For a disease that is absolutely preventable and definitely treatable, continued neglect and inattention should not have to be the case for a disease that could be eliminated with broad-based integrated control programs. We are here today to add our voice to the call for the recognition of Noma as a neglected tropical disease. We have the chance to make this disease a thing of the past and no longer the face of poverty. Let's take that first step to making that a reality. Usuere, nagode, merci, thank you.
Thank you, Dr. Maria. I would now like to invite Mulikat Okanlawan to the stage. Mulikat is a survivor of Noma and an MSF colleague, now working at the MSF-supported Noma Hospital in Sokoto, northwest Nigeria. More than 20 years ago, she came from Lagos to Sokoto to seek medical care and to find hope. Today, she supports other people affected by Noma and adds her voice to the global advocacy campaign to get more recognition for survivors of this devastating and neglected disease. Welcome, Malikat.
Good morning, everyone. My name is Malikat Okonlawo. I'm a survivor of Noma, and currently I'm a worker with MSF, working in Noma Hospital, Sokoto North, Nigeria. Thank you for having me in your midst today, for the privilege you give to me to share my experience in Noma with you. Thank you very much. Here is my story. I started my life and in an awkward way, not like other children, because of an unknown disease that destroyed the part of the face. According to my grandparents, they tried what they could, but the disease got worsened and destroyed my face. I was referred to a hospital, a teaching hospital, Ibadan, in Nigeria, Southwest. I was invited there. Then I was recovered from the disease, but however, the disease left a deadly mark on my face, which even hindered me from interacting or associating myself with people in the community. I couldn't go out, I couldn't go anywhere. I couldn't even look at myself in a mirror like other children. I was at home crying always. Later, my parents, they now took me to teaching hospital in Lagos, Nigeria. There I received my first surgery, but it was failed after multiple attempts. The outcome of the operation led to more how do I call it? Led to more emotional instability for me. And I often had that I couldn't survive the disease because of the impact of the disease. Later, I met a professor whose name is Professor Oni Idigbe, a former Director General of Nigeria Institute of Medical Research, Yaba, Lagos, Nigeria. He referred me to Sokoto North Hospital, Specialist Hospital, to see one white doctor whose name is Dr. Johannes Mezina, who organized my surgery there. I had my successful plastic surgery in Sokoto North Specialist Hospital about 5 times before getting to this present stage, both from Dodge Foundation and MSF. And after that, I began to admire myself and had to take pictures like other children. Then I began to relate with people in the community, so on. Then I enrolled in school to be able to catch up in life, but the life is still not meaningful to me because some students doesn't like to relate with me because of the way I look. I got my first job in Noma Hospital, Sokoto. Later on, I decided to further my education. It was really tough because of lack of finance. In my final year, I lost my job, which still made it more difficult for me. But I held on. Today, I own diplomas in health information management. So after that, I was invited by Claire, by documentary team, to be part of a success story of life after Noma. And I thank Claire and Fabrice for their, I thank them for their, how can I call it? for their support, for them to having me in their global, in their successful global, in their big global contribution in eradicating Noma disease. Thanks to MSF also for their global contribution towards this eradicating this social disease. Big thanks to all our donors all over for their global, financial contribution. I stand as a former Noma patients on behalf of all the other Noma patients to thank them all. Then a year in my own contribution in documentary, a year in my documentary, a year in my participation in the documentary, I was given a contract as hygiene officer to work with MSF in a field where MSF are treating Noma patients for free. So where I now contribute my own quota by giving them the words of encouragement, by the help of mental health departments in Sokoto projects. And I want to say this also. I think I've already motivated people in my shoe and use this medium to call for more global awareness of this deadly disease called Noma. And also, I want you people to help us put this Noma under the NTD program. Thank you very much as you listen to my story. I love you all. Thank you.
I would like to seek your understanding to now depart for the plenary. I have a country statement to make.
Thank you, Honourable Minister, and thank you to Molikat. Please, Minister, after you. Thank you, Molikat, for sharing something so personal to you and your journey. Your words motivate me. It motivates MSF as an organization, and it motivates the room to take more action against Noma. So thank you for sharing. You will be familiar with the devastating impact of Noma through the words of Molikat, and you can imagine the impact this has on individuals and communities. But perhaps some of you haven't come across Noma very much. And so to tell the story of Noma, I want to show you a short film created by the award-winning filmmakers Claire Jonté and Fabrice Catarini from Inades, officially selected in 2020 at the WHO Health for All Film Festival. So please enjoy, and we'll come back afterwards.
Ina kwance lokacin ina kamar zazzabi, yana jin na hiyo kumbura duka. In sa hannu na hina jin in yayi laushi. He nake kuka. Ina kuka ina kwance ni ne kada a zaure ko da sa hannu in ji ya tsore.
Noma is a gangrenous infection of the face, which usually starts from the gum or the gingiva to the fleshy parts of the face. It destructs the bones, the soft tissue, and everything around the face. It affects children at the age of 2 to 7 years old, but usually from 2 to 4. It can affect anywhere on the face, mainly on the sides. And there is also a central noma which affects the nose and the upper lip or the lower lip.
No kaga da rawanin da ko da ni tashi da rawanin gani da ni wayo rawanin ga kullu irin ina tare da wannan rawani ina rube fuska na. Da sai ni hita tan wani kaya ni zabo ko Allah ya bani wallahi.
Na shekara ko ina tare da su. Ka gani don mata na biyu yayi duk sun ka jaye. Yan kayo ni an ka ce ko ni ai kila tahiya ni kai don ba mu so ne. Ce to ni mutuwa dai ka sa ni in tahi in bari.
Noma patients really have that stigma whenever they get into the society. It's hard for them to, integrate into the society because of the disfigurement on the face. And they also have a lot of difficulties while eating, while feeding, because if half of the face is down, is gone, is eaten by Noma, you'll find out that patients, have to do some maneuvers for them to get food into their mouth and then to swallow. And part of the problems they are facing is a speech problem.
When somebody is like that, definitely there will be intimidation between you and people.
Ni dai wannan ciwon ya hana ni abu da dama. Gaskiya wannan ƙarami abu da dama tana hana da na iya shiga cikin jama'a in zauna. Kuma haka da na iya wannan. Haka kana yawo haka a cikin gari. Da sosai da.
No one came to this hospital and go back remaining the same. Because the way they come, they will go back different. Since the operation was done, I'm so happy. I can go to anywhere. I can stand with people at anywhere. I felt I'm a human being like others. To anybody that is in my condition like this, they should not feel bad and they should not lose hope.
Hello to everyone.
Dr. Edibi, representative now of the Honourable Minister, and Dr. Maria for their support today. Thank you. Please have a seat. I would now like to transition to the second part of our event, and it's to our panel discussion where we've gathered a range of experts on Noma through their professional expertise and lived experience with the disease. I am honoured and welcome to the stage Fidel Stroop, Noma advocate and president of Noma Aid Switzerland. Welcome, Fidel. Dr. Isa Shafu, Chief Medical Director of the Noma Children's Hospital in Sokoto, Northwest Nigeria. Dr. Boladali Alonge, Director of the Dentistry Division, Federal Ministry of Health, Nigeria. I actually think she's just outside with the minister. She's coming up. And then finally, Dr. Gabriel Alcoba, MSF Neglected Tropical Disease Advisor and member of the Swiss Alliance Against Neglected Tropical Diseases. Thank you all. Great. So I'd actually just like to start with, to give the panel an opportunity to briefly introduce themselves and what does working with Noma mean to them.
Good morning, ladies and gentlemen. My name is Dr. Shafiu Isa. I'm the medical director of the Noma Children's Hospital, Sokoto, in Nigeria. I've been working with the hospital for close to 10 years now. And I had the privilege to treat close to 2,000 patients who happened to be affected by Noma disease. It's been a wonderful time working there because a child who is being brought to you between life and death, having, received him, resuscitating him, bringing him back to life, and then taking him to different surgical steps, and bringing back smile to that child is really amazing. I think it's the most wonderful feeling. I had the opportunity to study outside my country, Nigeria, that is in Bulgaria. I trained there for more than 7 years. And I felt after my training to go back to my country and serve my people. And I'm still serving them. So I think is, the most wonderful feeling I'm having working there as a doctor there. Looking at children as well, who could not actually sit down and eat like other children with their locked jaws, want to eat, want to chew, want to drink, want to speak to the people or to their parents or to their peer groups, but they cannot because they are being affected by this deadly disease, Noma. And the worst part is only about less than 10% really do make it to the hospital. About 90% do die at home because they could not get that medical attention they're supposed to get after being affected by the disease. So I would like to really appreciate being here with you to share our experiences back home with the children who are being affected by Noma and to voice out for them
to advocate also for them, because there are very few fundings in the project of Noma, and we want the global voices to reach to where they should reach for these children, you know, to get help from us, from me, from you, and from every other person who could actually voice out for them. Thank you very much.
Thank you, Dr. Shafri. Fidel's group.
Hello everyone, good morning. My name is Fidel Stroop, and I'm a Noma survivor, and I was saved and rescued in last minute, you can say. Noma is for me a disease which is quite fast in killing, so it takes less than a few weeks until you are dead. And I'm really glad that finally, after nearly 30 years, that it gets its attention, which it really needs, finally. And now, if I look back from now and what we have done the last few years, we are advancing really fast, and it's a good sign. So that means it gets the attention it needs, and for me, it is also something good, because as a survivor, you are struggling every day. It's not a disease which you get as a little child and you survive it. It is a lifelong fight which costs a lot of energy, a lot of self-motivation, and it is hard for one to integrate into the normal life, into the society. So fighting Noma is not just something which is recommended, it is a must to fight Noma. The cost of preventing Noma is lower than the maintaining the lifestyle of someone who has Noma. You have the medical bills, you have to go more often to the doctors, you have to go to speech learning, you have to learn how to eat, how to interact. I had more than often to listen to doctors say, Fidel, you won't be able to do this, you won't be able to do that because of your deformation of the face. And somehow, through my sheer determination, I succeeded to do exactly these things which were presumed not possible. So, for me, it is more than ever important also for Mullikat and every other survivor that we come together and help each country to fight against this disease. And I really commend the sheer bravery of Nigeria and the health minister, that they came forward and told them, yes, we have Noma, yes, we want to fight it, and we need your help to do it. And I want, as a survivor, also to contribute to it and give my advice, the insight, what happened to this disease, and what we have to look for, or also respect, what often got forgotten, the psychological effect, the medical effect, how can we prevent it, and we want to guide each and every nation in this world who may have or has Noma, to help them understand what to do and lead them the right way out of this disease. Thank you.
Thank you, Fidel. Dr. Alonge.
Thank you. I'm Dr. Bola Alonge from Nigeria. For us, we want to target the 90%. Because we know prevention is key. Why do you have to have Noma? Why should 90% die? We don't want it to happen. So we go all around, you know. We have sponsorship through WHO by Establishing Noma in Nigeria. So we go all around the states, one at a time, training the trainers who will in turn go to the communities to campaign, social campaign on prevention of Noma. We collaborate with so many established structure of government. We call some of them national orientation officers. They are not even health workers, but we train them. Every state we go, we have people from each of the local government areas. We have national orientation officers. They will go back because they all have offices in all the local governments in Nigeria, already established structure. So we make use of them to reach out to the community, to educate them. Noma should not even exist anymore. So that prevention, which is cheaper and better, would happen. We also train community health workers. You choose the J choose. We train the health workers. We train traditional rulers who are also key, in addressing the communities. We even train traditional birth attendants. So when we go to every state, we reach out to them, and we then in turn try to encourage them to make use of their established structure so that we don't have to sponsor them every time. Every time they go to the communities, maybe on polio eradication, they should also talk on Noma. We have the posters we give them. So they always send to us. We have the platform. So they in turn tell us, this is the community we went. We took the posters around. We talked about Noma. Although they went for polio, they went for nutrition, but we keep on trying to, prevent Noma. And we believe that Noma will be eradicated. We also know that we need the global support because they also need, sometimes they need sponsorship to go on to train the people we want them to train, to reach out to the people. And we believe when we continue like this with global support, Noma will be eradicated, not only in Nigeria, but everywhere. Thank you.
Thank you very much. I'm Dr. Gabriel Alcoba. I'm in Médecins Sans Frontières, coordinating the Neglected Tropical Disease Working Group. And I'm also representing the Swiss Alliance Against Neglected Tropical Diseases, as I work here in Geneva and the University Hospitals of Geneva. And I'm very proud and I'm really honored to be here in such an important opportunity. It's really amazing. I'm really proud. It's obvious. I think we believe it's going to be eliminated. You are completely right. I think we also technically and strategically, we think it is so obvious that Noma is a neglected tropical disease. It fulfills all the criteria. We've been working for other neglected tropical diseases to fight against them, to include them in the list of neglected tropical diseases at WHO, NTD department. And actually now I'm really very privileged to be here, as I see that the Ministry of Health of Nigeria has taken the sponsorship, and other countries are following, and I'm really appealing also to the Swiss government. I think Mr. Alain Berset has received a letter as well, and I'd really like to continue explaining that this is strategically and technically a feasible fight. The tools are there. We've seen WHO work on the roadmap against snakebite, against leishmaniasis, against sleeping sickness. All of these neglected diseases. There are also other neglected diseases that are less neglected than Noma. Noma really fulfills all the criteria again. So really, I think there is a need for a roadmap. There is a need for a clear pathway for better surveillance, a clear pathway for better monitoring, early detection, as you said before, really of the simple gingivitis of the mouth, and of course, capacity building, training, nurses, nursing schools, medical schools. I trained as a pediatrician. I've seen patients with Noma, but it was not until I saw a patient suffering from Noma that I realized what that disease was. I didn't learn it in medical school in Switzerland, a very good medical school. I didn't learn it elsewhere than in the field, and really confronting the suffering and the stigma of Noma. And of course, it's such a deadly disease. We only see those who survive. So I think it's really very important to highlight that, and thank you very much.
Thank you very much. I might just go to one question for myself to the panel. And why is it that we know so little about the burden of Noma around the world? And what do you think are the main reasons for this? And I think if we can keep it brief, but I'd just like to start with Dr. Shafu, and then we'll take it from there.
Well, Noma is not actually a very well-known disease, as there are only few researches on it. Presently, only a few bacteria and some other socio-economic factors that really that are being, pointed at to be the cause of Noma, but it's not yet, well recognized yet. But researches are being underway, I'm sure, in knowing what Noma is. There are factors, as I've said, timely immunization, nutrition, and some other factors. But these are very few key factors that really prone a child to Noma, to get Noma. So I believe people who are here, stakeholders, the NTD, Swiss Alliance, for neglected tropical diseases and other organizations, I believe researches are ongoing, to know the actual cause of Noma. But either way, these are the main factors.
Thank you, Dr. Shafu. Any other comments related to this on the burden? Does anybody else want to? I think we've covered pretty well the neglected nature of the disease and the factors that actually contribute to the development of the disease. You may or may not know that Switzerland has played historically a very key role in the fight against Noma. And one such person who has been leading this fight has been Bertrand Piccard. And to reflect on one of these questions, he was unable to join us today in person, but he has submitted a short video. Bertrand Piccard is the co-founder of the International No Noma Federation, psychiatrist, explorer, and chairman of the Solar Impulse Foundation. And in this clip, he shares his recommendation for the way forward to achieve global recognition for Noma.
Hello to everyone. I'm Bertrand Piccard, the president of the Winds of Hope Foundation. It's now more than 30 years that some institutions have started to fight against Noma. For the Winds of Hope Foundation, it's more than 20 years, together with a lot of other associations, creating the No Noma Federation. What did we try to do against Noma? Early detection, prevention, therapy, surgery, political involvements with the countries of sub-Saharan Africa. We've done everything we could, but we cannot do more. And Noma is still there. Noma is probably the most atrocious sickness that exists. If you see a child with no face, because it has been eaten by the bacteria with necrosis, with gangrena, You see the inside of the throat because there is no nose and no mouth anymore. You just cannot accept that it is only due to poverty, to malnutrition. We cannot accept that. But if we want to do more today, there is just one thing we need to obtain. Noma needs to enter into the international network of health. That means that the World Health Organization absolutely needs to put Noma on the list of the tropical neglected diseases. If it doesn't happen, Noma will continue. Of course, all these associations will do what they can, but they will not succeed. Only WHO can now do what we have not been able to do. Only the World Health Organization, and I repeat it, by putting Noma on the list of tropical neglected diseases, can make a stop to this absolutely unacceptable situation of our world today. So this is what we absolutely need to do all together, and it's really the prayer I'm doing to the World Health Organization. Please now help us to stop Noma, otherwise it will continue.
What we're trying to achieve here, I'm not sure what is. I have a specific question that I want to then now target to Fidel, and it's about how do you, as a Noma advocate, see your role in championing the agenda on Noma in the future?
That's a very good question. And I think the main thing in all this endeavor we are boarding now is that we need to include every survivor who wants to speak up, like Mulikat, who's doing a great job here, also talking about her experience. We need to share the experience of each and every survivor, so you all can better understand what we went through. And that's also one of the reasons why we are trying to create a survivors association where you can go up to us and we will come to you, or we will do a presentation and talk about it and share the experience. So that means that working as a neutral entity between health organizations and political entities, it is sometimes easier to speak to one who's neutral than when it comes from the WHO, who says, hey, you guys, you have a problem. So if we come here and help you to guide you politically, or even just a bit in the social, economic way, how to come back to fight Noma, I think this would be a great way to fight Noma. And poverty is often linked to lack of money, but Noma is not just lack of money, the missing of funds. It's just the missing information of people saying what is Noma. And I think when we work together and give them a guideline how to go through, I think we can fight Noma quite easily without a lot of money. And it takes really few things to fight it. We need information, education, infrastructure, healthcare system. So we just need the basic things like oral health to advocate it. And if we start it this way, I think we can help and fight more than just Noma. It will help and benefit us all for the future and make the world a better place.
Thank you, Fidel. I think we're coming now to the end of our panel session, and I just want to do another round of applause for our panel, Dr. Shafi, Fidel, Dr. Lange, and Dr. Alkaba. You can please have a seat. We're now moving on to part 3, our final part of today's event. I would now like to warmly invite our final speaker for today's event. Dr. Bente Mikkelsen is the director of the Non-Communicable Disease Division at the WHO, trained as a gynecologist. Trained as a gynecologist and obstetrician, Dr. Mikkelsen previously worked at the WHO Regional Office for Europe in Copenhagen. Thank you very much for joining us. Great to have you. Thank you. Oh, I'm not sure.
Thank you very much, and it's actually me that should thank you, so all the applause goes to you. And thank you again to Médecins Sans Frontières and the Swiss Alliance Against Neglected Tropical Diseases for your kind invitation to attend today and for organizing this. We just came out of a consultation a few weeks ago, and I must say that was one of the most touching consultations we have ever had in WHO. And it was very much also thanks to Mr. Fidel Strobel, because having you as part of our efforts and having people with lived experience is, I think, completely necessary and cannot be exchanged with anything else. So again, fantastic. And I didn't hear the other person with lived experience here, but thank you very much for coming. And of course, I would especially like to thank the Honorable Dr. Osagie Enhari, and I actually met him on his way out here, the Minister of Health of the Federal Ministry of Health of Nigeria, for his ongoing support, and also congratulate him for continued efforts and commitments in the fight against Noma, that include also the lead in the development of the dossier of Noma for submission to WHO later this year. I would like to emphasize, and it might be not so clear if you're not in the UN system, but having the global leadership from global leaders at national level, like the Honorable Minister, is absolutely necessary. We need global leadership and we need countries to step up, and I think we could even encourage more countries to step up for this cause. So let's try that together as well. So as was mentioned in the panel, Noma is more than a public health challenge. It is actually a fight against extreme poverty and human development issues, and it is, of course, a matter of social justice. After the inception of the WHO program to control Noma back in 1994, the WHO Oral Health Program and the NCD department, which I'm leading, and this is done under the very ample leadership from Dr. Benoit Varenne, which you know, which also is with us today. And we have been trying to add our efforts, especially in the primary role in coordination and advocacy, in partnership with WHO Regional Office for Afro and Africa, which is really leading on the ground, and they are also listening in here today. And the support from all the partners that we have been presented to today. And we need more partners, I would say, and we need to include these local and international NGOs, researchers and governments, and get all hands on deck. Our joint efforts have particularly encouraged member states to take an integrated approach to the prevention and control of Noma through addressing its modifiable risk factors and their underlying social determinants, which are shared with other neglected tropical diseases. So of course we were very happy when the landmark resolution on oral health adopted by the World Health Assembly last year specifically requested the Director General to include Noma in the planned WHO 2023 review process to consider the classification of additional disease within the roadmap for neglected tropical diseases 2021 to 2030. It is a very important landmark, and I must say that the Minister of Nigeria and the government of Nigeria is now followed by the rest of the member states in WHO in this effort. So at the meeting, Dr. Gautam Biswas, my colleague, the NTD director at WHO headquarters, presented the current criteria for classifying a condition as NTD used by the NTD STAG. In addition to these technical aspects, it was pleasing to see a range of stakeholders coming together to understand, consider, and for most of them confirm the role of the fight against Noma. We have had a range of stakeholders presenting at that meeting, including member states, WHO, academia, implementing partners, which is also here today, and very importantly, Mr. Fidel Strub, who are, as we all know, a strong advocate. And it was news to me that you're also now trying to coordinate the people affected by and living with. I think that is a very good step forward. And please let us know how we can also include this in our general effort to use lived experience as a co-creating force. So at that meeting, and I would love to see the film again, we were also receiving messages of hope by the Surviving Noma, the documentary by Inedis. It was incredibly powerful, I think, for all of us to hear the voices of those living with, but also people at the marriage with people with Noma. So this is one of our core pathways in our work, and to give power to the people living with, but continue to work with all partners. As I have already mentioned during our past meeting, our success in the ambition of reducing Noma to a disease that no longer exists depends on our capacity to collaborate. We have all a role to play. And I think we heard that in the panel again, so thank you for moderating such a nice panel. And as we move forward, a truly interlinked collaborative effort is needed, and I am delighted to see this momentum continuing, and also the gathering here today. Under the mandate provided by WHO through last year's landmark resolution, we will continue by informing and facilitating the work of member states on the technical aspects of the dossier. So please do not hesitate to reach out to us. We need each other and we need information, and we will do our ever best to get there. We are also committed to explore how we can further foster relationship with partners to better mobilize and coordinate and facilitate support. So again, I would like to thank you, and I hope that we will manage to get there, and thank you for giving hope to this very, very horrible disease. Thank you.
Thank you, Dr. Mikkelsen, for your openness, leadership, and just bringing the room together and summarizing up the challenge that we face with Noma, but also giving us hope for the future, that we will indeed tackle this most neglected of neglected diseases. So thank you. We are now at the end of this event on Noma, a disease that should not exist anymore. We've heard about the clear leadership from the Honourable Minister of Health of Nigeria, Dr. Osagi Ure, who aims to eradicate Noma in Nigeria. We heard of the lived experience of Noma survivors Mulikat and Fidel, and what gaps in our knowledge exist about the disease from a panel of Noma experts. There are a large number of organizations already involved in the fight against Noma, including those of the No Noma Federation and the International Society for Neglected Tropical Diseases. Through these global partnerships, we will achieve our ultimate goal, that Noma is no longer neglected and indeed, eventually, eradicated. The listing of Noma onto the WHO NTD list is an important next step in the fight, and I am delighted to see Nigeria leading the way on this ambition. As we leave today, I urge you to share what you've learned today with your friends, families, and colleagues, and maybe share the short documentary we saw earlier this morning. We are a diverse community brought together today in a common fight against Noma. As I bid you farewell, I want to thank the Honourable Minister of Health, Dr. Osagie, Dr. Bente Mikkelsen, and all of our speakers for sharing their knowledge and reflections with us this morning. Finally, thank you all who joined us here in Geneva in this wonderful location in this busy week of the World Health Assembly, and to those online from every corner of the world and for your continued support in fighting to end Noma. Please enjoy a final cup of coffee before you get into your hectic rest of your days, and thank you for your time and your support. Thank you.